we may be having some technical difficulties, but we're still going to do our thing because we are here because we are absolutely passionate about what we do. For those of you who don't know me, I'm a speech and language pathologist, and I've been in the healthcare field for 20 years. And I work primarily with autism and traumatic brain injury. Those are my loves. And so I'm also a 21-day sugar detox coach, a certified professional life coach, and I'm this close to completing my doctorate in health psychology. So you might say that health and wellness is sort of my jam. I am an outspoken, very passionate advocate for health advocacy. And luckily for me, I'm not the only one who feels that way. So I have my colleague and friend here, Dr. Chance Martin, and he is a physical therapist. And I'm going to let him tell you a little bit about himself. And then we are also going to talk to this gentleman back here. He's going to be introducing him. And we're going to tell you about like where we're at. So Chance, I would love for you to address everybody.
Awesome. Thank you for the introduction, Angelique. I'm excited to be here and thank you guys for joining us. My name, of course, is Chance Martin. I am a doctor of physical therapy. And I have been out in the healthcare field long enough to realize that there is an issue, and it starts early. I noticed that people don't move as well as they used to, and unfortunately that leads to chronic issues. We start off young, we start off moving well. There's not any movement faults necessarily when we're young besides learning how to move, and then once we learn how to move, unfortunately we move into this society that basically says, hey, you need to stay indoors, you need to watch TV, you need to be engaged in life by checking your phone every 5 minutes, maybe checking the internet, staying engaged that way versus actually getting out and enjoying, especially in this area with the beautiful Ozark Mountains that we have. So what I'm here to talk to you guys about today is really, I want you to get out there and find something that you love and do it every day. Movement is vitality, and that's basically how we prevent and how we cure chronic disease is get out and move more and move often and move well. And I really appreciate you guys hanging out with us today, and I would like to introduce someone to you. His name is Aaron, and he works here at this fantastic place called Dynamic Earth. If you ever have any questions about gear, if you want to get out and enjoy the outdoors, because I know the fall time is coming up, he's the guy you want to come check out. So without further ado, here's Aaron.
Thank you, Chance. Thank you, Angelique. Again, my name is Aaron. I am the assistant manager here up at Dynamic Earth Equipment, located in the Green Circle Shopping Center on Republic Road. Some of you may be familiar with us already, but those that aren't, I'd just kind of like to talk about what we do here. We are an outdoor gear retailer, so we sell everything from kayaks to climbing gear to outdoor apparel. We also sell layering systems. So whether you're gearing up to go on a float down the Buffalo River, or you're gearing up to go hiking, or you're trying to get into climbing, you're trying to scratch the surface, something like that, that's what we're here to do. We sell, again, comprehensive gear systems, so everything you could possibly need, from a backpacking trip to just a simple day hike backpack or something like that. We have you covered. We have a very knowledgeable staff here. If you come in, ask anybody a question, anybody can help you with anything in the store. We're very well informed. Also, if you need any ideas on how to stay active while you're outside, we'd suggest, while it's still warm, maybe get into some kayaking, stand-up paddleboarding, hiking and backpacking. That's definitely a fall and winter sport. Not as many bugs, not a whole lot of overgrowth going on. Same thing with climbing. It's not so hot out there, you can go outside, stay cool, have fun, not overheat. Excuse me.
Not to interrupt you, but do you guys have groups that you offer here that you organize so that if somebody is looking to do some climbing or such, that they, like, where would they go? Where would they start?
So we don't do like a regular group. We do offer special events though. So every fall and every spring we do have 2 dedicated climbing trips we do. So in the fall we have one called Rock Trip. We have actually yet to announce the date or plans on that. There's one in the spring called Pebble Wrestle, which actually is a climbing competition. Somebody may have heard something about some of that, but we are on social media. We do Facebook and Instagram both, so be sure to like us or follow us there. If we have any event details, we always post there. We always have flyers up in the shop. Of course, you can always stop by or call if you have any questions about anything like that.
Awesome. I love that.
So as far as introduction to climbing goes, I have to give a shout out to Zenith Climbing Center, the new climbing gym in town. They're very helpful people over there.
I didn't even know about it. So glad you told us.
Yeah, if you're looking to get into climbing, I'd suggest heading over there. They get you set up, teach you belay techniques, proper climbing techniques, safety, all of that stuff.
Awesome.
Sounds like we have a field trip in the works.
Absolutely,
Chance.
absolutely. Check us out next week. No, I'm just kidding.
Yeah, check us out as Angelique is face down, on the floor.
Do you two have any other questions for me about any of the products we have, or anything at all?
I don't think so right now, but definitely we know where to go. And like he said, make sure that you like them on Facebook and or Instagram so that you're up on when the events are coming. And I think that's something that I always like to try to do things to challenge myself. So that may be my new spring challenge. So I will definitely be liking and such.
We look forward to having you.
Thank you so much for
You're
your
welcome.
time.
Thank you.
I appreciate
Thanks,
it.
Aaron.
Thank you.
Appreciate it.
Thank you guys. Appreciate it.
All right, we're back. Okay, we're kind of thinking that we're gonna be like the next Kathy Lee and Regis. So we're trying to hone our skills, right? This is our first collaborative Facebook event, really kind of our first collaborative presentation. So that's what's kind of even more exciting to us, because our goal, we are both super duper passionate about making sure that people are excited, engaged, and empowered about their health and wellness. And that's why Chance and I, we are working so well together, both as colleagues in our therapy practice, but also we have the same mindset when it comes to the patients that we see, and then the people at large that we see that suffer chronically from so many conditions that are actually preventable. And so since Chance knows way more about movement than I do, and that's definitely part of my practice with working with my clients, it only makes sense for me to pair with somebody who knows more about it and who is just as passionate about this as I am. So Chance, our topic here is the top 3 health conditions that we are concerned about, and that we want other people to be concerned about as well, because this is your life. We're living our lives, but we've also had to do the work. Well, we've done the work, we've had the experience, and we're continuing to do so, and we're continuing to build on that. And we know stuff, and so we want to teach you, and we want to get you guys to that place where you are just as excited about your life as we are about ours, and about for yours as well. So so Chance, one of the things that we talked about when we were coming up with some things that we thought would be relevant was chronic pain. And so
Absolutely.
I really want you to talk about that, because we've had great conversations about that, and I think you're prime to talk.
Absolutely, that's what I see day in and day out at the clinic. Is unfortunately the chronic pain epidemic is just now starting to come into the limelight. A lot of media and stuff is actually starting to realize that, hey, opioids aren't always the answer. Unfortunately, there's lots and lots of side effects to opioids, and people just really don't feel that great when they're taking them. I've seen so many people come in and say, hey, I want to try something natural. I want to try something besides just the opioids that offer a little bit of relief. Studies show that really opioids aren't the long-term answer for chronic pain, and what I see every day in the clinic is people come in and they're scared to move. That's very unfortunate, because that's exactly what they need. They need to not be afraid to move, and they need to understand that just because that pain is there, it doesn't necessarily mean that there's any tissue damage. There's just been so much unfortunate jargon going around saying, hey, you have a bad back, oh my gosh, you shouldn't lift more than 5 pounds. It just teaches you all this fear, like my back's about to fall apart. And one of the best things you can do is actually learn to embrace a little bit of that discomfort and understand that you're not causing tissue damage, and getting out and actually moving and finding something that you enjoy is what's going to get you better, because chronic pain isn't just about the tissues. It's about I'm depressed, I'm stressed, I'm not who I used to be because I'm in pain all the time. And I really try to teach my patients that, hey, you got to find something that you love. That's what's going to get you better. And exercise in the long run has been shown to actually reduce inflammation in the body, has been shown to reverse these chronic things that we have, not just pain. So you have diabetes, you have obesity, you have heart disease. These kill 70% of Americans. That causes 70% of the deaths in the U.S. per year. And unfortunately, all of those things are preventable. And one of the underlying factors that we need to pay attention to is definitely movement. Now I know it isn't just movement that we need. A huge factor of this, actually the number one modifiable factor in these chronic diseases is your diet. And as Angelique kind of opened my eyes to this, sugar, unfortunately, is one of those things that has been pushed onto us, and it causes all these side effects, and it releases all these feel-good hormones in our brain, and it causes us to crave that. So the sugar causes inflammation, which causes our back to hurt a little bit worse, which keeps us from wanting to move because we've been told, hey, you have a bad back, don't move it. And what we're really here to do is to say, you know, don't be afraid to move. Go find you a natural cure. Go ask a few more questions. Say, hey doc, is there anything we can do besides just this opioid it's helping a little bit, but I want to get back to doing what I love to do, which is playing with my kids, which is going for hikes, which is going for climbs, because like Aaron was saying, the fall's coming pretty soon, guys, and that's a great time to get out and start walking a little bit.
Well, what would you say in regards to people who are watching this, you know, either now or later, and they're like, wow, right, you're right about all of this, but I don't know where to start. I hurt, so it hurts. I can't go and do a hike. You know, I can't go start training for a half marathon or a 5K even. You know, where would you begin? Where would somebody begin who feels hopeless? Because we all know that if your health goes, you're going to focus solely on that. That's why we are so passionate about this, because anything else can be going awesome in your life, but if you even have a toothache, right? You focus solely on that toothache until you have relieved that pain and you know that you're okay again, that you find out what that cause is, and then you're like, oh, okay, I'm all right now, and then you can move on. When you're in survival mode, nothing else matters. So we get it. We're trying to get you to get that awareness and then move past that. So if somebody's feeling hopeless, don't know where to start, what could we offer them? Where's the glimmer for them?
There's lots of great free resources. I know that a lot of people can't afford to go join maybe Pilates or yoga class. Those are great resources as well for battling chronic pain. If you want to go check out YouTube and look up videos by this guy by the name of Lorimer Moseley. He's got great videos that are about 5 minutes in length and do a great job explaining what pain is, and that's exactly what you need right at this point in time, guys, is education on what pain is, because lots of times people, whenever they're actually educated on pain and that it doesn't equal tissue damage, your pain actually starts to go down to those levels that you can tolerate moving a little bit more. If you ever have any questions, feel free to reach out to me personally. Send me an email. I've got lots and lots of great free resources. I've got a pretty cool new thing that I've started with my patients. Actually, I'm starting to prescribe exercise. I know we've kind of gotten to this mindset of a prescription cures, and if I prescribe an exercise, it seems like people are like, oh my goodness, this actually works. It has that really cool mindset.
So you think if people maybe Google searched on YouTube or whatever, maybe basic exercises, just stretches,
Absolutely.
Even walking, even if you think, well, I'm not going to go out and just like walk a mile, that's okay. Like just dedicate yourself to maybe like walking 300 feet, I don't know.
Walk 5 minutes and then take note of how you feel after that. If 5 minutes was too much, that's okay. Start the next day with 3 minutes. It's not about how much you do day one, it's just about getting moving. That's essentially what you're looking at doing.
And being consistent. And those small little steps that you take will always add up to big changes. Absolutely nothing will change overnight, and that's not what we're wanting to happen either. We are wanting maybe some awareness to start seeping in, and then the changes will gradually take shape for you, so that's what we want. And he touched on diabetes and also obesity, and those were our other two concerns that we had. We see in our clinic a lot, and I see pediatrics, and he sees adolescent and adults, so we see the whole range. And I see children that come in who are far heavier than they should be. And we talk also about diabetes. Well, some of these kids are most likely pre-diabetic, and certainly if they continue on the same path that they're on, they are going to eventually have type 2 diabetes. So we're not talking about type 1, we're talking about the acquired diabetes, so it's type 2. It used to be called adult onset diabetes. And somewhere along the line, I really don't know the date, you're my numbers guy, so you have to look that up for me. But somewhere along the line, it changed to just type 2 diabetes because adults were no longer getting it. And that's sad, right? And this isn't just because we have some new disease process that has, dropped out of the sky and has, created all these problems. No, it is systematic choices that we have made as a society. Our evolution as a society and evolution is driven by our cultural choices and our activities. And as Chance mentioned earlier, the foods and such that we have generally offered to us, that we've generally taken advantage of, are processed, readily available foods. And unfortunately, not to sound all conspiracy theorists or whatever, but unfortunately, those foods are put out not because they're concerned about our wellness. They're put out for profit of the companies that make them. And I don't think that's really a secret. I think that most people would agree that, a pack of Twinkies, of 12 Twinkies that costs, $2 or whatever, is probably not a very valuable food, especially if you flip it over and read the ingredients on them. So, so I concern myself quite a bit with, with children. And one of the things that we've talked about before is having children be active, because again, we see these children that, their core strength is terrible. Their balance is terrible. Their fine motor is terrible. They have a difficult time, manipulating. Their thumbs are great, but they have a hard time manipulating, getting a lid off of a jar. There's just no strength. And, so the climbing, that Aaron talked about, I mean, oh my gosh, that would be a perfect thing for them to do. Getting kids outside more on these jungle gyms and playing with Play-Doh, putting puzzles together, doing yoga. I mean, I'm a speech pathologist, but guess what? I do yoga with my kids in my my therapy room because I'm working on their core strength so that they can sit up straighter, so that they can project better, that they have better vocal resonance and better respiratory dissociation, with their ability to speak. And it's all, everything is top down, inside out. And there's no way that we can expect our children to live even as long as we've lived if we don't change something with them first. And obviously, if we don't know, we can't do what we don't know. So if we're not practicing it, if we're not aware, then how are we going to make our children aware? Now, they may find out a little bit later through, a friend or through an advertisement. And I do think I see the climate changing a little bit in terms of, what's being offered food-wise. It's not just about eating less and moving more, though. I mean, would you agree with that?
Absolutely, 100%.
Yeah, I mean, you want to move. We're not saying you shouldn't move, but it's more that I think people are in that mindset, have been told that it's your fault if you're fat, and it's your fault if you're sick. Well, I mean, yes and no. I mean, yes, you're the one that puts the food in your mouth, but if all you're offered are these selections that you assume are fine, then you're going to consume them because the marketing label said that it had 20 grams of protein and it was
all natural.
Right. And the FDA has a very broad template for what they can consider organic or, such and such. That's a whole nother, live stream that we'll get into in regards to food. But we're wanting to, the purpose of us doing this today is just to kind of get you thinking. Hopefully some of our talking points have kind of, sparked something in you to where you want to learn more. And you can definitely reach us. As he mentioned, you can email him. And so what would your email be? The best email?
The best email is Dr. Chance Martin. You want to put a period in between the doctor, the chance, and then it's at gmail.com.
Now, is that DR or DOC?
DR.
Okay, so DR. DR period.
DR period,
okay.
Chance period, Martin at gmail.com.
Awesome. And we can also follow you on social media.
Absolutely.
And that is?
My Twitter account is Doc Martin DPT.
Is there an underscore in that one?
There is not an underscore in that
Okay,
one.
Just checking.
Yeah, not on that one. Actually, sorry, take that back. I was put on the spot here. It's C Martin DPT. No underscores there. That's my Twitter, and of course you can like this on Facebook and send a shout out, and I'll be paying attention to the questions on Facebook here as well.
Mm-hmm. And on Instagram, you are.
That one I'm not sure.
I'm pretty sure. Correct me if I'm wrong. His wife's sitting in the background there. I think it's Doc DOC Martin _ DPT. Pretty sure. So,
Probably.
Yeah, pretty sure. So, also, for me, you can contact me at drangelique17@gmail.com, and that is no periods, drangelique17@gmail.com. I have a group on Facebook, which is Fabulously Paleo, and so you can request to join that. I would be happy to have you. And then, where else am I? Oh, I'm on Snapchat, and and that is Dr. Angelique also. And I do a lot of tutorials and such on there, and I do like food reviews and such. So there's a lot of current information always happening there, plus just stuff in my like crazy life too. So I'm a lot of fun. I don't know. That's all that whole social media thing that we have to like take care of. But is there anything else that like you think you would want to address?
The last point I would like to touch on, it kind of encompasses everything about the chronic pain, not moving enough, the diabetes. Don't pay attention to the scale. Health isn't about what you weigh, it's about how you feel. And you've got to get your mindset right. You've got to understand that you got to quit beating yourself up and get out there and do what you love. Throw away the scale. Larger people can be healthy too, I promise you.
Absolutely. You know, I see people in my yoga class, which I'll go ahead and plug my hot yoga. Absolutely love them. You know, I see people in my yoga classes all the time, and man, there are people that can do the crow. I can't even do the crow. I've been working on it forever. I'm still working on a handstand, you know, and I have people popping up in all shapes and sizes. Yoga is for every body. And, you know, just stretching a little bit makes a huge difference in the way your blood flows and in the way your blood pressure, you know, can be controlled. It's just amazing. So that's I used to run, and I did 7.5 marathons in 2014. I was a crazy person. But I really enjoyed that, and I learned a lot about my body. And that's the thing, is we want to help you find your baseline so that you know how your body functions. You know, we can't possibly know when it's covered up with pain, and, you know, we don't feel good, we can't think well, and we can't move well. So how can you possibly know? That's not your body's normal state. It's not. So we want to help you get to that normal state. And so we have many more live streams that we're going to be doing. We have some presentations at different places that we're going to be doing. So we'll, of course, advertise that. We would love it if you guys would be there, because we will be sharing a lot more. This is kind of just like our little teaser stuff. So, but I'm really excited that we were able to do this today, and we definitely look forward, I think, to doing more.
Absolutely, absolutely.
So I want you guys to feel free to comment. I know it's a live stream, and if comments have been coming in, obviously we've not been able to address them right now, but please, even if you're watching it on the replay, you can go ahead and post comments or questions for any three of us, and we will definitely answer them. So,
absolutely. And a huge shout out to Dynamic Earth. Thank you for letting us be here today. What a beautiful facility. Please come check them out.
Yeah, we were really lucky. So
Absolutely.
I kind of feel like we've arrived, Chance. I don't know. I think we're pretty awesome. So anyway, well, thank you guys so much for tuning in. And again, leave us comments, questions. We'll get back to you, okay? Thank you so much.